So many times in my life, I have gone to a doctor for whatever the issue may be and told, well, if you just lose weight, this will go away. To the point where I kind of got my standard answer was like, yes, I'm overweight and I have this other problem. Like, could we address that? It's been about a year since my procedure. There really isn't an area where my life hasn't dramatically changed. I went through some traumatic events around college age, really started to struggle with my weight, used food as a coping mechanism, and it just kind of got a little more out of control, and before you kind of know it, it just becomes a slippery slope. It's at a point where it feels unmanageable, hopeless. I got up to close to 450 pounds. My uncle was diagnosed as a type 2 diabetic and really started having very serious complications. Hospitalization after hospitalization, insulin issues. The medical issues were endless. I was diagnosed as pre-diabetic. And on that same day, I said, I need a referral. This is not an option for me. I'm not willing to live this way. And I'm willing to be aggressive with regard to my health and getting to a place where I can live the life I want, whatever that may look like. So I did undergo the Roux-en-Y procedure. At the time, the best outcome was the Roux-en-Y, so I went the most aggressive. And that was the right choice for me. When I underwent the procedure, it was difficult. I was out of work for 6 weeks. I was very, very sick. I lost about 150 pounds, and that was in the first 9-10 months, I would say. When COVID hit, it was really tough. You know, you're not going out of your house, you're not interacting, you're not moving actively. And so I put some of that weight back on. I'd actually met with several bariatric surgeons to explore the possibility of a revision and was told, look, if I do this, I have to take more of the bowel and you are going to have lifelong problems. By chance, I got put in touch with Dr. Thacker. He introduced the Apollo Revise as an option for me, and it was game-changing.
I remember when Bren first came in, she was struggling to find someone that would help her with some weight regain that occurred after her prior gastric bypass. So like many patients who get a gastric bypass, they're very successful at first. And I would say that she was successful and she had tremendous weight loss from the original procedure. But over time, we know that things can stretch out. That's one of the reasons, and people can start to gain some of the weight back. I remember her specifically because she was struggling to find someone that was willing to take on her situation. She had told me that she had tried talking to a surgeon, but they were reluctant to revise the gastric bypass surgically because it is a riskier procedure. Someone's already been operated on, and for a surgeon to go in, I get the hesitation because there may be scar tissue, other considerations. The procedure does have a complication rate when you try to redo it surgically. And so she was the perfect candidate for the revised procedure because that's exactly the patient that it's really designed for. With the revised procedure, we can go back in and kind of hit the reset button.
This procedure is so cutting edge, it gives you options that previously simply just didn't exist. I was down a weekend, not 6 weeks. I was able to lose the rest of the weight. I was able to do all the things that I wanted to do, and I've gotten the outcome that I actually really wanted.
So what we do with this procedure is we go down through the mouth. First, I'll start looking around with the camera, and then assuming that either the pouch or the outlet are wide, I'll kind of game plan on how to best revise it and get it back down. So typically it involves a little bit of cautery around the outlet. I'll then take a stitching device that's attached to my scope, go down, and I'll put a stitch around the outlet, or sometimes at the edges of the outlet, and then basically just pull it tight, scrunch it back down, and get it nice and snug again. If the pouch is dilated, then we can also put some stitches in the pouch and scrunch that back down again. You know, unlike a redo surgery where they have to be hospitalized and go through incisions, etc., we can do this without incisions. For many patients that come looking for some kind of redo of a gastric bypass at our institution, often the revised procedure is the first stop.
So I started this journey obviously at almost 450 pounds. I'm now at about 175. By no over-exaggeration, it has given me my life back. Walking up the stairs to my office was something I would dread. It was a challenge. Didn't want to go places because I was exhausted. Now there really aren't things I'm limited by, and the most important thing is I'm able to play with the kids in a way that feels good to me. I'm able to show up for birthdays, show up for school events, show up for the concerts that they're in, and those are things that I wouldn't have been able to do before. Pretty much every aspect of my life has changed. The Roux-en-Y was a step, but it didn't get me to the finish line. Dr. Thacker's procedure did.
Everyone has different goals. For some people, it's about the number on the scale. For others, they want to be able to get back to doing things that they weren't able to do before, which I think that was very important to Bren. I'm so happy. You could just tell that she was really, really happy about how this went.
This is a very personal decision, but for me, there has never been a moment where I have said, even in the worst, hardest moment, there has never been a moment for me where I have said, I made the wrong choice. I wish I could go back. I wish I could do this differently.
The procedure is the right tool for the right patient at the right time. If someone had a bypass and they've gained the weight back, it's not you're done and there's nothing we can do for you, which unfortunately a lot of patients with gastric bypass are told. We have more tools, and this is one of them.
Absolutely go for it. Absolutely go for it.
This is the right one at the current time for the right patient, and that's the way to think about it.